All right, and now we're going to get started. Hi, everybody. My name is Lucy Dong, a Childcare Health Consultation Program Manager for Best Starts for Kids. Super excited to have you join today. And yeah, it's fun to see some new organizations, new names, at least new to me, if not new to BSK. And again, the session is being recorded. So if you don't feel comfortable showing your face, you feel free to turn off your cameras. I won't feel offended. So welcome. This is the Best Starts for Kids virtual open house for Childcare Health Consultation. And I want to give you a brief overview of our agenda. We'll do a few introductions. I'll go through a super brief overview of Best Starts for Kids, because I think most of you are quite familiar. And then I'll talk through Childcare Health Consultation, a little bit of background of what it is, and then how BSK approaches it. And then I think the most exciting part is we are going to hear from a couple current partners, so CISC and Encompass. And then once you have a little bit of a better idea of what Childcare Health Consultation is all about, I'll talk more about the upcoming Childcare Health Consultation RFP. That's coming out this quarter, and then we'll have time at the end for some Q&A and discussion. Does anyone have any questions before we dive in? Okay, so I introduced myself. I also have my teammate here, Adrian Lopez. He's helping with tech support. If you have any issues, you can feel free to chat him in the chat box. And as if you have any questions as we go along, I won't be monitoring the chat super closely, but feel free to pop it in, and then Adrian, you can feel free to interrupt me so we can answer questions as we go along. All right, and let's see. Hi, Gayleen. Welcome. Good to see you. We're just getting started. All right, so I am going to, sorry, letting one more person in. I'm going to invite you to just chat your, what position you are in, and, or sorry, what role and what organization you're from, because I do want to learn a little bit about you. And if there's anything that you're interested in making sure that we cover today, I'd love to make sure we capture that. So feel free to chat in the chat box. And I also want to introduce Sarah Regal, who just joined us. Sarah is my manager and has been managing school-based health and childcare health consultation for many, many years, longer than I have, so has a lot of historical knowledge that we can tap into.
Thanks, Lucy. Glad to be here. I'll be happy to answer any questions that might help.
Awesome. Thank you, Sarah. And thanks for chatting into the chat box who you are and what organization you're with. All right, so I'm going to start off with a little overview of BSK. Our vision and our little tagline is that we wish that all children and families are happy, healthy, safe, and thriving. Our investments in BSK 2.0 look like this. There's a few different categories here, but I just want to call your attention to investing early. This is the prenatal to 5 investment area, and that's where childcare health consultation lives. So it's not under that larger childcare, around 200 million funding. And so just so you have a better idea of how childcare health consultation fits in with the rest of the work of BSK is in the prenatal to 5 investments, the direct services work kind of falls into different areas so that we can make sure that we're reaching children and families in all of the spaces that they are. So Adrian Lopez is also our home-based services program manager. So providing, supporting programs that work with families in their own homes. We have Hannah Mohammed, who some of you may know, who does the community-based parenting supports program. So that's supporting families in the community. And then we, of course, need to be supporting children in childcare. So that is my work. All right, let's see. So I have a short little video clip to share with you all today. And this, I think, does a much better job than I could of giving an overview of what childcare health consultation is and what it looks like. So I want to start playing. If you're not able to hear the video sound, just raise your hand or let me know.
Childcare Health Consultation is a collaborative partnership between a trusted childcare health consultant and caregivers or childcare providers to promote the optimal health, safety, and development of children in their care. Childcare health consultants may include community health professionals, mental health specialists, nurses, nutritionists, health educators, or inclusion specialists. Consultants work with people who care for young children, including family, friend, and neighbor caregivers, family home providers, and center-based childcare programs by providing one-on-one consultations, trainings, and resources at the caregiver or provider's request. Examples may include supporting the completion of developmental screenings, including making referrals and supporting follow-up with families, training on best practices for safe sleep, and developing strategies to support children in care who have special healthcare needs. Childcare providers and caregivers report that partnering with a childcare health consultant increases confidence and abilities to improve health outcomes for children. Childcare health consultation leads to reduced numbers of suspensions and expulsions, which disproportionately affect young children of color and children with disabilities. Current services in King County are provided in a number of ways by entities and individuals with a variety of backgrounds and experiences.
Okay, so I know that cuts off a little bit abruptly, but I know that we'll be hearing a lot more from some of our current partners, CISC and Encompass soon, so you'll get to see more of what this looks like in practice. So I wanted to highlight just a few elements of what the video talked about. So childcare health consultation services are typically multidisciplinary. It can be some or all of these roles that are described here. And it's very much strengths-based. So we know that childcare providers are really skilled, very capable, but it's a super challenging job that they're responsible for. Taking care of kids and all kinds of concerns or different situations can come up. So that's really where our consultants come in, and they really support childcare providers with a broad range of physical, social, and emotional health needs and concerns. The work is also trauma-informed and very much relationship-driven. So some background about childcare health consultation in King County is that it far predates Best Starts for Kids. So we have a childcare health program that's been operating for 30 plus years. It might be 35 years now, Sarah, something like that. It's been around for a long time, and we have one of our amazing nurses here, pictured here, Ellen Flamiados, who's holding a precious little baby at an infant room visit. So this program has been running for a long time, and before 2009, it actually served all of King County, and then unfortunately, due to some budget cuts, had to reduce the scope and is currently primarily serving City of Seattle childcare provider sites. So we've been able to build off of this work in Best Starts for Kids. So I want to talk a little bit about our approach to the work. So first, I want to kind of highlight, when we talk about childcare providers, we're trying to be as inclusive as possible. So oftentimes I imagine when folks think of childcare providers, they're thinking of childcare centers. So those facilities that are providing regularly scheduled care might have multiple classrooms, lots of little kids they're taking care of, multiple different age groups. But I don't want us to forget family childcare homes and family friend and neighbor caregivers. So the home-based care is also super important to the community and is a big part of how families and children receive childcare. So family childcare homes, they're licensed to provide childcare and education services for 12 or fewer children, and this is in the provider's living quarters. And then there's family, friend, and neighbor caregivers who are, grandparents, their aunts, their uncles, their neighbors who are providing quote unquote informal care. And they're legally non-licensed and not regulated by the state. So I'm gonna, give me 1 second. I want to pause here for just a second for you all to kind of think about this. If you're a parent, what kind of childcare do you use for your child? And then if you're like me, who doesn't have kids yet, or maybe if you're not planning to ever, think about when you were a kid, what kind of childcare did you use? Did you attend? Because for me, I'll just share personally, this work feels really important to me because I remember, when I was like 2 years old, I was sent to a childcare center. It was huge, it was overwhelming. Everybody was chattering away in English, and I didn't understand English at the time because we only spoke Chinese in the home, and cried every day. And my parents ended up pulling me out of that childcare center and ended up sending me to this neighbor down the street who was already taking care of 2 other kids. And I remember I called her Popo, which I later realized was not her name, but is how you say grandma in Chinese. And it was a lot more comfortable. My mom was able to communicate with her about my needs more effectively because they could just speak in Chinese. And it was, culturally appropriate care, right? So I just want to emphasize that, those FFN caregivers are also childcare providers and should not be left out when we talk about childcare providers. And I wanted to highlight this statement from DCYF, the licensing body, that both in Washington and around the nation, FFN care is the most common type of childcare for infants and toddlers and for school-age children before and after school. So we really want to make sure that we're not leaving them out of this picture when we talk about childcare health consultation services. So a little bit of background on how we did our RFP in BSK 1.0 is that we kind of broke it into 2 different models. There was the public, quote unquote, public health model, which is for teams that were kind of modeling their childcare health consultation program off of Public Health Seattle King County's childcare health program. And then we had, we funded community, quote unquote, community informed pilots. And these were innovative pilots to deliver childcare health consultation in a way that's culturally and linguistically appropriate and or community specific. And so we funded programs through both models, but actually what we found over the years is really we funded 7 very unique, very community specific models. So they were all very much community informed. So the focus communities that were included in our BSK 1.0 services, we had 2 programs that were specifically focused on serving licensed family child care home providers in the Somali community. We had CISC serving Chinese and now also Vietnamese family, friend, and neighbor caregivers. We had East African and African American family, friend, and neighbor caregivers being served. And when I say East African, I'm talking about Somali, Ethiopian, and Eritrean caregivers. We had a program with specifically serving providers that are caring for children with special needs and helping them with the inclusion of those children. And then we have kind of geographically specific programs, so serving East King County and more of that rural childcare providers, which you'll hear more about from Caitlin shortly, and then South King County childcare providers as well. So there were 7 different programs funded in BSK 1.0 from 2018 through 2021. It was about $8.5 million awarded for these. programs. So that's all I'll say for now. I'd love to pass it over to Helen Zhang from CISC to share more about their programs, because I think it's really important for you to hear from our current partners. And I will also invite you at this time to just, as you listen to Helen and then listen to Caitlin, to think about how these services might be beneficial for your communities, or how you could see a new program like this be started for your community. So I want to stop sharing now and I'll pass it over to Helen.
Thank you, Lucy. Okay. So I can share, right?
You should be able to.
Okay, sure. Hi everyone, I'm Helen Zhang. I'm the coordinator of CCHC program with CIC. We started a CCHC program from 2018. This is the program with CIC is very new. We are working with FFN caregivers, including Chinese and Vietnamese FFN caregivers who are taking care of young children from 0 to 5. FFN caregivers are grandparents, aunts, uncles, or other relatives, neighbors, and friends. For Chinese and Vietnamese families, grandparents are always the first choice for childcare for the families. Just as Lucy said, it's our tradition. FFN care is a tradition and the most important non-parental childcare in Asian culture. And also as immigrants, Chinese and Vietnamese caregivers, FFN caregivers, they are all LEP, and many of them are socially isolated with very little support, and they are unfamiliar with American culture and norms, and have very limited experience accessing and navigating complex systems, including health and educational systems that will help them or the children in their care. How we do the program with the IC. First of all the staff are bilingual and bicultural, so that they can communicate with our FFN caregivers in their home language, which is a very important part. And we also have bilingual nurse and family educator in the team. We can consult the nurse for some medical and nutrition knowledge. And our family educator will provide a lot of support for the family, and she will do internal trainings for us. And for a lot of the resources are in English, so we need to translate, integrate, and adapt the materials to be culturally understandable to families in our program. And also we honor cultural heritage and positive bicultural identity development through the use of bilingual language books and cultural relevant materials and content. And we also hold cultural celebrations for the families. And we use a strength-based approach to increase a family sense of efficacy, especially for the FFN caregivers. What we do, we offer workshops at libraries before the COVID in different communities to make them easily accessible and reduce transportation difficulties for FFN caregivers, because they are taking care of the kids and they don't know how to take buses sometimes. And after the COVID, during the pandemic time, we are doing virtual group training and it works very well. And also we offer ASQ and ASDSE screenings for the young kids. We serve FFN caregivers regardless of their immigrant status. We're offering more services to FFN caregivers who live in remote areas. We are flexible scheduling for consultations based on needs. We also offer referrals to the caregivers to refer them to internal or external partners. Yeah, as the successful strategies or the key to the success, I think should be the following following things. We are doing. We try to be the partners of the caregivers. We just sit there and to be the support of them, and especially get through the difficult time of the COVID-19. We try to be humble and respectful for different backgrounds and cultures. Even we are Asians, or we are all from China or Vietnamese, we're from different parts of the original country. Yeah, we have different costumes or different backgrounds. And we support the culture and language heritage. The grandparents, they are playing a very important role for the language to be passed on to the next generation. We are taking ongoing training to be knowledgeable in the area. And within our team meeting, we are doing self-learning, and we also do self-reflection with the teammates. All the staff are from the community, where we understand what the real needs of the FFN caregivers. And we also include caregivers in decision-making process. We prepare all the topics according to the needs of the FFN caregivers. That's what I have. Thank you.
Thank you, Helen. So does anybody have any questions for Helen about their program? If not, I will invite Caitlin Young from Encompass. Oh, let's see. I see a question in the chat from Nikki. What has outreach to caregivers look like?
Because CIC, we have been working with immigrants for a long time. At the beginning, we recruit the clients from internal reference. We have other early learning programs, and they referred a lot of families to us. And then after we have some clients, our clients will spread the word out to their community, to their friends and neighbors or relatives. Yeah.
And then we have one more question from Margaret in the chat. Does CISC provide its own early learning childcare or childhood program, or just consult with FFMs?
So are you referring, Margaret, are you referring to like a licensed childcare program?
Sorry, if I can talk. I think you answered that by saying that you have internal referrals from your other programs. So I didn't know if you just brought in family FFN caregivers because the photos had a bunch of people like in one location, or if you went out to families.
Oh, I see. So we do go out.
Does that make sense?
Yes. So we do go out to families, but we also, we have activities like for the FFN caregivers bring their kids over. So to do cultural celebration or also be able to connect with each other, because we know a lot of the caregivers are very isolated, don't even have an opportunity to connect with each other. So we do like play day or, like a Kaleidoscope Play and Learn group. So we incorporate all these and invite the FFN caregiver and their children to come to the group. But most of the work is done by, in-home, used to be in-home, but now it's virtual consultation. Did I answer your question now?
Yeah, for CCHC program with CIC, our main working content service is in-home visit consultation, and now it's a virtual consultation. Hope I answer your question.
Yeah, I see Margaret said thank you in the chat. Does anybody else have questions for Helen Huiling? Not, I will pass it over to Caitlin Young from Encompass. And if you do think of more questions, feel free to pop them in the chat and we will have time for more discussion at the end. All yours, Caitlin.
Thanks, Lucy. Let's see. Like Lucy said, my name is Caitlin Young, and I work with the Encompass Childcare Health Consultation Program. And our program is a little different than other programs at Encompass. Encompass offers preschool and ECAP program, pediatric therapy, early intervention ESIT, parent-child plus, play groups. And the focus of our services is the child care providers, as opposed to the child directly or their family. And I have a short little video, so part of this is about 2.5 minutes, explain the rationale behind why we focus on the adult caregivers.
Caitlin, I'm not hearing anything on my end. I'm not sure if the sound has started yet. Are others able to hear?
No?
No,
I'm seeing
not hearing it.
shapes.
Make sure you're also checking the share audio box.
Yes. Hold on. It didn't pop up like it normally does.
I think if you,
Share sound. Here we go.
oh, yeah.
Let's try that again. Hear that now? Okay.
Yes, yes.
The social challenges that face modern societies, whether it's the ability to work productively, to be a good citizen, stay healthy, have their roots in early health and development. A strong foundation in early childhood results in much better and more effective development later. A weak foundation really puts us behind. The most important thing children need to thrive is to live in an environment of relationships that begins in their family, but also extends out to include adults who are family members in childcare centers and other programs. What children need is for that entire environment of relationships to be invested in their healthy development. We've shown from decades of testing interventions that we can improve outcomes. But the magnitude of those impacts is not good enough. Science is now available to help us think about what we might do that would have a bigger impact than the best of what we've done before. So we began to ask, what could we be doing differently? What could we do to be smarter? Children who are at the greatest risk for the poorest outcomes in learning and health and behavior are children who experience a pileup, a cumulative burden of one after another of risk factors. And then the burden is more than any child could be expected to overcome. So we began to focus on the development of the adults. What could we be doing to strengthen the capacity of everyone who interacts with children? This led us to think about the kinds of skills you need to deal with adversity. These skills of focusing attention, planning, monitoring, delaying gratification, being able to solve problems, being able to work in teams, executive function and self-regulation. They're also the kind of skills you need to create a well-regulated home and school environment in which healthy development and learning can take place.
Okay, so that was kind of our grounding idea when we initially applied for funding in 2018. Our program overview, we provide supports to, we kind of say, anyone who's taking care of kids that aren't parents and aren't schools. So licensed childcare centers, family home childcare programs, part-day preschool programs, before and after school care, summer camp, family friend and neighbor care. In the Snoqualmie Valley, which is runs kind of along the far east part of the county, North Bend, Snoqualmie, Fall City, Carnation, and Duval. And it was our goal to be able to give childcare providers support to resources, support, and training to help support children's social and emotional well-being, their development, and help with referrals and overall well-being. Because what we run into in the east part of King County is that there are very few childcare programs. And so if your child is having a hard time in one of those programs, either due to some self-regulation, some development concerns, behavioral concerns, and they get asked to leave a childcare program, there really aren't many other places to go. So it was our goal to support providers so children can stay in care. We have a small but mighty team. Myself, I'm a nurse consultant and I do program coordination. We have Kim, who is a speech language pathologist and specializes in infant early childhood mental health. And Megan, who is a licensed social worker, manages the behavioral health program and focuses on trauma-informed care. What our delivery model looked like pre-COVID, we would do outreach, which often was drop-in visits, phone calls, emails. If programs were interested in receiving consultation, we'd visit on a monthly, I would visit on a monthly basis, and we would talk about a monthly resource that I took from a variety of well-vetted sources that we would discuss, and then talk about any kind of needs that children were having, teachers were having, and then scheduling follow-up observations and supports as needed. So that mainly was done in person, and for the last 2 years or so, we've been almost fully virtual with emails, phone calls, and the occasional Zoom. We offered group trainings, and we've offered them on developmental screening, infant and toddler feeding, mindfulness, and a meditation for caregivers, behavior and sensory and self-regulation. We support, I did the math once, I think it's about maybe 70% of the licensed programs in the area, as well as some part day preschool programs, about 45 total providers, but it can vary over time. We mostly cover questions about growth and development, referrals for further evaluation, either with ESIT, early intervention, or the Encompass Pediatric Therapy Clinic. Consult on health and safety, lots of questions about immunizations, as well as hot topic in the last couple of years, communicable disease prevention and COVID response. And then how to increase physical activity and ways to get kids moving outside. Kind of an example of some work that we have done this past year. We developed classroom sensory kits and lending library items that we were able to give to some local programs. Weighted blankets, fidgets, body sock, hammock, headphones, and then self-care kits for teachers. So snacks, affirmation cards, some water bottles, things to just let them know that we were thinking of them and that we know what a hard job they've been having as they've been caring for children as essential workers throughout the pandemic. Added some books to our lending library and then also had some of the books in the kits. And the total value of the kits was about $300, and we were really glad to be able to provide that for centers because quite a few of the programs we work with are either family home or privately run, and so they really operate on a shoestring budget and don't necessarily have the funds to buy these extra items, even though they would be beneficial for kiddos. We've also done quite a bit of training for our team members to help support the providers in being able to create an environment of those responsive relationships that's invested in the healthy development of children, like the video. We are all certified in promoting first relationships, which promotes caregiver reflection and awareness of feelings and needs in the caregiver and also children, and offering positive feedback and focusing on mindfulness to help support those self-regulation skills that helps, if the adult has it, they can help the child develop that as well. We also are trained in circle of security, both parenting and in the classroom, which focuses on promoting secure attachment as a protective factor in young children. And it develops their skills to respond to children's emotions and needs as opposed to specific behavioral management techniques. And we also have offered trust-based relational intervention trainings, which is based in connection, attachment, sensory processing, and brain science, with the focus on how to address physical needs, how to address attachment needs, and how to respond to behaviors that are based in fear, but then also the response is based on brain research. So what does that look like? These are some teachers from the Encompass preschool program, and they went through a 5-week training on trust-based relational interventions and also had sensory kits. And then the toddler room teachers had, come to the childcare consultation had attended those classes and then had come back to the team and asked about what can we do with our circle time, because we're having a hard time getting it to run the way that we're wanting to. And so after some observations, we offered the suggestions around using the fidgets, giving children a sense of control and how they could incorporate sensory input, and as well as visual supports. And you can see our little friend here has her fidget popper and her spot where she matches her face and sits there. And it's been a great way to help teachers kind of put the training into practice. In the next year, we are taking additional training, CPR and first aid instructor courses. So we'll be able to offer that training to childcare providers, training on supporting social emotional well-being, additional curriculum on that. Hosting some additional training for childcare providers on racial equity and environmental lead and toxics, and then expanding developmental screening. We had initially thought that we would do training, so we would train childcare providers to implement developmental screenings. But given just challenges in childcare, staffing, pandemic, there's plenty of they're wanting to, but putting into practice has been a little hard. So we have changed to supporting programs with the online portal, so teachers and families complete the ASQ and the ASQSE online, and then we review the results and support the teachers in conversations around the results and supporting the referrals as needed. So we just started that, and it's going really well. And that's what I have.
Thank you so much, Caitlin. I love hearing both from you and from Helen. I feel like every time we, I hear from you, I learned so much more. And does anyone have any questions for Caitlin about their program at Encompass, or just any thoughts, discussion items? I think if there's not any questions, that's because, Caitlin, you covered everything so thoroughly. If anyone does think of questions, feel free to pop it in the chat. But in the meantime, I am going to share my screen again. And give me 1 second. And just share a little bit more about what's coming up for Childcare Health Consultation in BSK 2.0. And that kind of RFP timeline that many of you are probably interested in. Let's see, can you see my screen? See not, okay, awesome, thank you. So CCHC and BSK 2.0. So here's kind of high level of plans for BSK 2.0. So the service delivery RFP will be opening on June 15th. So if you're interested in applying, please mark your calendar. These will be 3-year contracts. We have a council mandate, I believe, that the contract period cannot be beyond 3 years. So that's, this round of funding would be for 3-year contracts. And so that would be starting in January 2023, go through the end of 2025. And we have around $8.5 million to give out. And you might notice that that number is the same as what I shared for BSQ 1.0, but that 1.0 was across 4 years. This is across 3 years. So there actually is some more funding that we get to work with this time around, which is exciting. So hopefully we'll be able to expand our partners and the communities that we serve. The funded partners will have technical assistance and capacity building supports, both from kind of general BSK as well as specific funding from our program area. And we're also working really closely with Hannah Locke, who manages the innovation support body of work for Best Starts for Kids, to create a at least 6 month startup period for new partners. And so what that means is that, as Helen was sharing for their program and Caitlin's sharing for their program, these programs started, brand new in 2018. There was a lot to kind of get the program up and running. And so this time we want to build in that period of time and build in those supports more intentionally to support you in like how you're going to approach the work, how you reach out to the communities that you want to serve, who are you hiring onto your team, what roles are they, what is your logic model going to be for making this difference and impact that you're hoping to make, and things like that. So, and then priorities for funding. This is kind of things that I'm thinking about based on feedback and based on observations that I've had over the past few years, but will definitely be informed by a work group. So could shift a little bit, but I want to be focusing on continuing to deepen investments, especially in serving home-based childcare providers and caregivers, especially FFN, who are often left out of these kinds of services. And also expanding our reach to other communities that are not currently being served. So you might have noticed on that slide that I shared earlier of the different communities that we had, a big gap is the very diverse Hispanic and Latino communities we have in King County. We don't have services currently really developed, tailored for those communities, and Indigenous communities and many, many other of our communities in King County. So the more that we can expand services, the better. So the timeline, this is kind of high level. I broke it up into the different seasons of the year, if that helps you conceptualize it a little bit more. So Q1 of this year has been all about stakeholder engagement and getting a work group launched so that we can develop the RFP together. And today is March 30th, the RFP open house, and then we're very quickly moving into Q2, which is kind of the big, when everything happens. So we're developing the RFP with the work group. We're going to have the RFP open for 6 weeks, starting June 15th, and then closing in July 27th. So all of August will be about, application reviews. We'll have recommendations going through BSK leadership, through departmental leadership, through council members before we finally have those award decisions made. That takes a bit of time. And then I'm hoping that in September, we'll be able to announce the award decisions, and then September and October, complete contract negotiations with the awarded partners. And then my goal is that by October 31st, all of those new contracts are signed. So you have some time to kind of prepare yourself for starting those new contracts in January 2023. That's that overview. Any thoughts, questions, feedback you have for me? We have about 9 minutes left, so feel free to chime in, unmute yourself, or throw a question in the chat. Let's see. Laura Carter, are you going to have any other information sessions between now and June 15th? So this is more of just kind of helping people understand what CCHC is all about, and just to know of the upcoming opportunity, and feel like if it's a good fit, apply for it. After the RFP is released, we'll have 2 info sessions, and that will really be focused in on, walking through the RFP, what are the different components, what are we asking for, answering any questions you might have. So that's going to come later in June. So nothing between now and June 15th. But of course, if you have questions, feel free to reach out. Yeah, Sarah.
Yeah, I wanted to just add that too. You'd be open to questions. I think maybe what people are wondering now is, is an idea I have something that would fit into this RFP, or what if I proposed XYZ? Would that be something that's aligned with your goals for the strategy? And somewhere between now and July 5th or June 15th would be the best time to talk to Lucy about that. So just to be clear, things change after the RFP is released. It's harder to answer more specific questions about your ideas. But before that, now is a good time that Lucy's available and open to talking with you about the ideas you have, and your agency is qualified, all the kinds of sort of technical things, and she can sort of talk through some ideas with you if you're interested in applying.
Yes, thank you, Sarah. I always forget to say that, but yeah.
Yep, just want to make sure we differentiate those two. So those are different ideas. And then someone asked also about current grantees and their role in the application going forward.
Will current grantees also need to apply for continued funding? Yes. So this is Fresh Start BSK 2.0. This applies to all of the different strategy areas. Everybody is going to have to reapply for funding. Right now, we have extended the current partners through the end of this year, so that way there's no gap in services between BSK 1.0 and then the new partners in BSK 2.0. And so those partners could be some of the same partners, could be a mix of the same and new. We don't know yet, but everyone will have to reapply. And Adrian, I think you unmuted for a second. Was there anything you were going to add?
No, it was about the question that you were bringing. Yeah.
Okay.
Yeah.
Okay, perfect. Anyone else have any questions, thoughts, or feedback, like anything you think I should be considering as we develop the RFP? Because as Sarah said, it is still in the formative phase. So now is the time to kind of, influence, even if you don't think it's a good fit for your organization or your community. I'd love to hear your feedback on whatever it is. I'll also say, if you are interested in childcare health consultation, doesn't feel like the right fit to be doing the service delivery perhaps, but you are interested in the work, I would love to invite you to be on the review panel, because the more community members we have, the better. So keep in touch with me. You have my contact information, and I'll share it again at the end of the call. Let's see. I see a question from Margaret. Does childcare health consultation need to include all types of consultation, health, social, emotional, etc.? Margaret, I'm curious, can you say a little bit more? Like, are you thinking of providing a program that just focuses on one area? Novice focuses on infant mental health. Yeah. I'm open to being influenced on this. Sarah, do you have a take on this question?
Yeah, I think part of the, what is childcare health consultation is very much being responsive to community needs. And you can see by the differences in our current grantees in terms of how they provide that service. They have been able to be responsive in various ways, providing different levels of expertise in different areas. I would, however, say that sort of the foundation is really about comprehensive support for young children and caregivers. And that would include some health education or focus on healthy development and physical health as well. So it might be that an organization like NAVOS could partner with another organization or contract with somebody external that has a slightly different clinical or physical health approach. So there are lots of different ways to pair that together. It's not unusual, and it would be great to think about partnership across multiple agencies to really provide the comprehensive support that's needed.
Yeah, that's a great idea, Sarah. Definitely all in great support of partnerships. There's also, you know, sometimes teams can have like consultants that they tap into in various different roles. So like a nurse consultant, nutritionist consultant, community health professionals that they tap into for different needs that come up. But maybe infant mental health is more of a primary focus, so that I would feel like is okay too. Any other questions? Let me check the time. We have 2 minutes left. I'm just going to share just a couple of resources before folks have to start hopping off. But if you think of additional questions, please do chime in. So I'm sharing my screen again. Can you see it? Yes, okay, perfect. So I wanted to share, we do have a couple reports available, publicly available on the Bsk Reports page. So the Childcare Health Consultation Year 1 report, evaluation report is available online. And this is based on the first year of data with the 7 funded partners in Bsk 1.0. And we do have a new report that's coming out very soon in April, which will include, I think, about 2.5 years of data. So that's really exciting. And then we have the Childcare Health Consultation Systems Development Report, which is another body of work we manage, and that is available for you to read more about as well. And then if you want to learn more about other Bsk opportunities, you can scan this little QR code and it'll send you to our funding calendar and a space to subscribe for updates. And as a reminder, this session was recorded and will be shared out on the Bsk blog along with the slides that we shared today. All right, that's all from me. Any last questions or any last thoughts, feedback, anything you want to share? All right. If not, I will let you all go. Thank you so much for joining me today. Really excited to see some new partners on the call. And take good care.